If you watched the previous anatomy video and are still confused of how that actually impacts your function and your pain, today I'm going to talk about disc herniations and the importance of understanding the anatomy and getting that disc herniation better. So today I'll use a little smaller model of the spine. So we still have the two vertebrae here just as a single segment of the spine, and we have the disc in between and the spinal cord with the spinal nerves. Now this is a little more dynamic of a model than what I was using in the last video, and so it actually shows some of the motion that we get in the spine. So within the spine itself, the disc itself, we have the outer layer of the disc is really thick cartilage, and within the inside it's a little more fluid. So that's why we can take impact and absorb that impact without damaging our spine. However, with time and with abnormal loads, that disc can begin to injure to where we get a disc herniation. Sometimes you'll hear it called like a slip disc or a disc rupture. All of those things are just describing an injury to the disc to where it begins to press outside of its normal spacing. So within that, with that abnormal pressure, you can see like it will begin to press out into space where it should not be. That pressure, if it becomes great enough, can push on a spinal nerve, and that's where you can get radiculopathy or sciatica coming from that disc pressure. However, discs can just naturally herniate slightly, and some people have these without having any pain at all. The important thing to realize is that we can help these resorb or heal on their own naturally without surgery, and long-term outcomes with surgery or without are actually pretty close to the same. So if you have questions about that, please make an appointment and we're happy to explain for your specific situation. But understanding that motion of the disc itself is very important to understand of how we can actually heal the disc through exercise, through joint manipulation, and through giving you advice on how to manage it at home. So if you have a disc herniation and are curious of the things we can do to help, please give us a call.